Well, as we continue to emerge from the COVID-19 pandemic, both things, pandemic, we're still counting the cost. In fact, there are so many ways in which our people and our children are suffering from the consequences of the pandemic. So one of the key indicators over the last few months has been an increase in the number of measles cases. That may be linked to the fact that fewer children have been getting vaccinated against the disease. Measles is incredibly infectious, so it's a way of determining what is actually happening to people. Dr. Sangiwe Moyo is the country manager at the Final Mile Consulting. Dr. Moyo, good afternoon to you. As I understand it, you've been conducting a study. You've spent a lot of time with 50 different families. They had young children. Those children were of vaccination age. What did you find when you spoke to them?
Good afternoon to you, Stephen, and good afternoon to your viewers. Thank you for having me. And, straight to the findings of our study. So we began looking at the impact of COVID-19 on routine immunization. And our findings show that, caregivers faced a paradoxical decision point in needing to appraise the risk of COVID-19 exposure and the risk of their children developing a vaccine-preventable disease. So vaccine-preventable diseases like your measles, polio, whooping cough, and so forth. So I think it was very difficult for caregivers and parents to weigh the decision between the two to say, should I go to a facility and risk myself getting COVID-19? I think the perception was that a lot of people with COVID-19 were going to the facilities. And do I then stay with this child at home and, avoid getting COVID-19 infection, but also risking the fact that they might get a vaccine-preventable disease in the future because they haven't developed the immunity against that disease because they haven't been on schedule with their routine immunization. Another thing that we saw was that the perceived danger of COVID-19 outweighed the risk of missing the routine immunization doses. So this resulted in a low uptake of routine immunization services in 2020, especially when we had the hard lockdowns. And even as they started easing out, some people were still hesitant to go back to facilities and get immunized. But also what we saw is that people haven't really dropped off necessarily from getting routine immunization. What they did was to delay the decision to go and get immunized. So I think our only worry there is that some people who have delayed might not have gotten back to be immunized. But I think you would appreciate from an immunity standpoint, coming from the backdrop that South Africa was not already meeting the mark of 95% vaccine coverage or routine immunization coverage. It's hovering around 83, 84% over the last couple of years before the pandemic hit. So now bringing that to that point where people are making the decision to delay the process in coming back, and there's that 10 to 15% that remain in the population that are sort of zero dose or don't ever come to immunize their children.
So before the pandemic, the issue of vaccinations was really just not questioned. My parents got vaccinated, no questions asked. I got vaccinated, no questions asked. My children, who are at late primary school, got vaccinated, no questions asked. Now it seems that maybe people are asking questions. And that could be a problem.
Absolutely, Stephen. And I think that's what we saw. And in our study, when we spoke to people, this was a default decision, just like you're relating. People didn't question routine immunization. This was like a ritual that every parent and every grandparent would pass on to their children, that this gets done. And actually, when we spoke to people, some people didn't even know what doses their children were getting, but they knew that according to the schedule, on the 3 months, on the 6 months, I have to go and get my child vaccinated. So there were no questions about it. But I think now with the shift of having new mental models of people thinking about, oh, there is a bad vaccine, and people are asking what could be the side effects of this and so forth. So yeah, some people are beginning to question vaccination overall. But we haven't seen a massive drop per se, but we've seen a delay, especially during the year 2020 and the early 2021.
So we know there are at least 137 measles cases now. There are a few, and it is possible to get measles if you've been vaccinated, but the effects will be much less severe. So you must still get vaccinated is the point. But most of the cases may well be for children who weren't vaccinated. I mean, there's clearly a link, right? And I realize the measles outbreak may not have started here, but I can't recall a measles outbreak before. I mean, there must be a link.
Yeah, there have been. I think they've been small and isolated. But I think the point to reiterate is that people need to come back to routine immunization as soon as possible, especially those that have missed. And I think some of the implications from our study is that the bar for people to come back to join the schedule should be lowered. Because what we see is that people, when they get back to facilities, they get rebuked by the staff there for having missed. And there's little empathy and understanding that people have gone through a very terrible time during the pandemic. I think there needs to be that reassurance that people can come back and get immunized without facing a lot of troubles in doing so. And I think another point to highlight, Stephen, is that there were shortages of doses during the pandemic, especially the lockdown period. I think that might have been related to the overall global supply disruptions. But from a health system standpoint, that happened. For some of the respondents that we spoke to, those who could afford went to private pharmacies to catch up on the schedules. But also, that also speaks to how private-public partnerships can be seen. For example, if there are shortages within the public system, how can the private sector chip in those instances so that we don't come to a point where children don't have coverage? Because we know the risk, and we're seeing these cases that you've mentioned, the 136 cases that are happening in Mpumalanga and Limpopo right now.
Is there a concern? So most of us, I mean, I would have been vaccinated, probably the measles, mumps and rubella vaccine, that doesn't taste very nice on your tongue, but I don't really remember it. So if you miss the gap, is there an age at which you kind of need to be vaccinated by, otherwise you need to have a different vaccine?
I think the messaging is, as soon as you've missed a dose, the best thing is to go back, get to the facility and catch up on the schedule. There's a cutoff point. I think also with the routine immunization cards that the parents or caregivers have, there is clear guidance on what to do when you've missed. So the message really to the public is, if you've missed doses as a result of, like, you had fears of catching COVID-19 at some point, or you went to a facility and there were shortages of those routine immunization doses, get back to your facility, and the health facility would make a plan, maybe to show you to another catchment area where you can get the dose. But the critical point is, as soon as you realize that you've missed the routine immunization dose for a child, please get back as soon as possible.
Dr. Sangiwe Moyo, thank you, Country Manager for the Final Mile Consulting. Really appreciate the time.